Hi, Dr. Edward Schuster with your tip of the week. So, the nightmare has arrived. Doctors never really liked the idea of using generic drugs. You can complain about Pfizer and Merck, but we know they do a good job making their drugs. But we've been forced to use generics. If I don't use generic drugs, I get punished, I lose money, insurance companies are not happy with me. So all the doctors are using generic drugs. Two-thirds of generic drugs are now made in China or India, and we've been telling patients they're probably okay. But guess what? It turns out that a hypertension drug called Valsartan that's made in China has a chemical called NDMA in it that can cause cancer. So that doesn't make us very happy. If you're taking Valsartan for blood pressure, or if you know somebody who has high blood pressure, ask them, are they taking that drug? Now, some of the Valsartan is okay, but some of the Valsartan that was made in China has to be thrown out. Call your pharmacy. They will tell you if you have the good stuff or the bad stuff. If you have the good stuff, you can keep on taking it. If you have the batch that comes from China with the impurities in it, then you have to be switched to another medication. Sorry for the bad news.